Morning, Joanne.
Good morning.
I was having a little trouble with my desktop, but I found you on my Surface.
Everybody good to go? Great. Good morning, everyone. Thanks for joining us for our quarterly all partner meeting. We have a great lineup for you today. We're going to jump into a legislative update, and then we're going to be inspired by Noco Inspire. Before we get going, a couple of housekeeping details. We ask that you keep muted this morning during the presentation, but you can participate via the chat and reaction buttons. And as a reminder, this meeting is being recorded this morning. I'm going to jump right into our legislative update, and to lead us in that discussion, I'm going to introduce our moderator, Jonas McKinley. Jonas,
good morning, everyone. Thanks, Joanne. Yeah, good morning, everyone. Very excited to have this program. This is kind of one of my favorite updates that we give throughout the year. Again, we're always trying to bring interesting things to you guys, and this legislative session has been certainly interesting. So normally we do this at the end of May because the legislative session would have ended first week of May. That's kind of the typical schedule, but this year has been an anomaly. I think partly due to COVID. Maybe some of our panelists could explain that a little bit more, but we have an ongoing legislative session that's scheduled to end on June 12th, so we're still kind of in the thick of it. So I'm really appreciative to all three of our speakers today for taking time out of what, again, is a very busy time right at the end of a legislative session to come and just give us an update. So there's going to be things that they mention and talk about that are not resolved, that are still being worked on, that are still, maybe not quite out of committee or haven't been voted on and things of that sort. So again, just bear with us. But I think you're going to get some really good information, at least have an idea of what's been happening the past few months. And so, yeah, with that, I'm going to kind of turn it over. What I've asked is we have three people today kind of giving different perspectives. All from different organizations that are looking at the same bills, but maybe in a different light. So the hope is that you'll get kind of an overview, and then if you're so inclined, again, some of these bills are still happening. I know legislators are always looking for people to go to the Capitol to speak, to comment, and there's always opportunity to get involved. So out of today's presentations, if you want to get involved, certainly reach back out to the NOCO Health Sector at gmail.com email, and we can kind of get you plugged in with maybe one of our speakers or somebody else. Again, we're very active. Most of our members are with Northern Colorado Legislative Alliance as well. So there's opportunities for you guys to be involved and make a difference in this legislative session still. So first up, I have Joshua Ewing. Joshua is a health policy professional with more than a decade of experience in research, policy analysis, regulatory, and legislative affairs. He is currently the Vice President of Legislative Affairs for the Colorado Hospital Association. In this role, he serves as liaison to the General Assembly, state regulatory agencies, and the broader healthcare community of Colorado's 100+ hospitals and health systems. Joshua is responsible for advancing policy objectives that strengthen Colorado hospitals and improve the healthcare system in Colorado. He's led the organization's legislative lobbying efforts since the 2018 legislative session. Prior to joining the association, Joshua worked as a health policy specialist with the National Conference of State Legislatures, serving the legislators and staffs of the nation's 50 states, its commonwealths, and territories. He was responsible for facilitating and speaking at national policy meetings, conducting timely research, producing publications, and responding to legislative and media requests. Joshua also served as the organization's liaison to the Missouri General Assembly. Originally from the Show Me State, Joshua holds a master's degree in public administration from the University of Colorado, Denver, and a bachelor's degree in social work from Missouri State University. He now lives in the Washington Park neighborhood of Denver and enjoys hiking, snowboarding, and traveling with his wife, Molly, son, Jack, and their dog, Henry. Thank you very much, Joshua, and take it away.
Thanks, Jonas, and good morning, everyone. I got to get you all a shorter bio next time I do this. It's good to be with you. I appreciate the opportunity. as was said, we are still very much in the kind of the throes of the final days of the legislative session. It is a unique legislative session. We did take a 5-week pause when case counts spiked again at the end of 2020, heading into 2021. The legislature came back, did about 3 days worth of work, and then paused for about 5 weeks, which has thrown our calendar off. They can run through June 12th, but we remain hopeful that maybe they can wrap up work by the end of next week, so that we can all take a nap or take a breather at some point here soon. So CHA, in case you don't know, is the statewide trade association for Colorado's hospitals. We represent every hospital in the state. It's over 100 hospitals and health systems across the state of Colorado. And in addition to advocacy work, we do a lot of clinical quality improvement work, and among other things. So happy to be with you. I want to run through just a handful of bills that I think are noteworthy for this group, but really happy to answer any questions about these or any bills that you may have heard about in the session. I like to start with kind of what we're excited about, what we're supportive of, and then I'll get into kind of what I think has been top of mind for everybody this legislative session. So on the support side, a couple of bills I'm really excited about. House Bill 1107 was just signed into law this week, making it illegal to post the public information or post the information of public health workers, also known as doxing, stemming from some cases that happened late last year where addresses and phone numbers of public health workers were posted online and threats were made against them and their families. That bill was signed into law. It is now against the law to do that for our public health workers. I think an important protection for the people who were really out there on the front lines of the fight against COVID for us, doing everything in their power day and night to serve us. So a really important protection we were supportive of, excited to see that get signed into law. A bill that's still moving through the process, House Bill 1005, is a bill that will create a healthcare reserve task force looking at how we can better utilize our healthcare workforce to the full extent, in the event of the next pandemic or wildfires or any other type of public health emergency. A good example of this is that we really worked to cross-train our healthcare professionals, as many of you are aware. Throughout the pandemic, it was kind of an all hands on deck situation. And I think this creates an infrastructure to better do that, not just within healthcare facilities or not within hospitals, but really across our healthcare system. And I think it's bringing together experts to create a system in Colorado that will make us better prepared for the next public health emergency coming towards our state. Senate Bill 126 is an issue that we've worked on for a number of years, and it has to do with, it's not a sexy topic, I will warn you, but it has to do with credentialing of healthcare providers with insurance companies. And this has been an acute problem for our rural hospitals in particular, where we will bring in a physician or a provider. They'll start working, but we can't actually get them credentialed and on board with the insurance companies with which we're contracted with. It's used as kind of a delay tactic, and it has impacts on healthcare access in our rural communities primarily. There's a bill moving through that will put a time limit on that. It's been agreed upon between the health insurance carriers and the medical society primarily, but we're very supportive of that. It's nearing the finish line in the legislative session. And then House Bill 1021 will create for the first time kind of a regulatory structure for peer support professionals who have been an essential part of our behavioral health workforce for some time now. but House Bill 1021 will create a mechanism for them to begin getting reimbursed primarily through our Medicaid program, and create a regulatory structure for them to recognize them as key members of our behavioral health treatment teams. We've relied on peer support professionals for some time. They are excellent providers in the behavioral health space, operating from a place of lived experience. And so we're really excited that bill has just kind of completed its course at the legislature, and is headed to the governor's desk for a signature. Those were the support side. Let's talk about the more controversial bills that have been kind of top of mind for everybody. I'll start with Senate Bill 175, which is the Prescription Drug Affordability Board. This is a bill that does kind of two primary things. The first is it creates a transparency structure in the state of Colorado for a better line of sight into our pharmaceutical supply chain. This is something that we're actually pretty supportive of at the Hospital Association, because rising prescription drug costs are one of the leading cost drivers for hospitals, and one of the biggest pain points for our patients. So the transparency components of this legislation we are supportive of, but the bill also creates a new board at the state of Colorado that would have the ability to set an upper payment limit for the purchase of prescription drugs in the state. And while very well-intentioned policy, state pharmaceutical transactions happen at a national level. It's not something that state government really has control over. And so there are a lot of unintended consequences that will come with this. And we are very fearful that the way the bill is set up, it actually penalizes hospitals and providers and pharmacies, because they can't penalize pharmaceutical companies, that they're not regulated by the state. And so I think we're creating a scenario where hospitals and providers will be put in a position of actually breaking state law in order to provide life-saving medications for their patients. So CHA is opposing this legislation, but it is quickly moving through the legislative process, and we've yet to be able to amend that bill. And then I will end, and I will just start with Chris Brown as the expert on this bill. So he's gonna give you a lot more detail on this bill and kind of the inner workings. But House Bill 1232 is the Colorado option legislation. CHA is now at a neutral position, but have been working on this bill for years now. In 2021, day and night for months. The bill has changed dramatically since its introduction. We were able to get a number of concessions throughout the process. Just yesterday, it had about 5 or 6 hours of debate on the floor of the Senate. 5 additional amendments were adopted yesterday. I would say that we still have some pretty significant concerns with the approach taken by this legislation, but we are formally in a neutral position, and we took that, our board agreed to that position in order to secure some of the concessions we received in the House. Happy to go into more detail, but I think I'm about at my time. So Jonas, I will turn it back to you and look forward to your questions.
That was great. Thanks a lot. Yeah, and as far as questions, if you guys can type those in the chat. We do have some time at the end where you'll be able to ask questions of all three of our speakers. So yeah, if you would just put those in the chat, I'll make sure to ask those for you right at the end. And yeah, that way you can type them as you're thinking of them and not have to wait until the end to remember. So we'll kind of keep moving along. Next up, we have Allison Williams. So Allison is currently the policy coordinator at the Health District of Larimer County, and this role will be ending at the end of the month. So we're really glad that we were able to have her one last time. If you've been attending our meetings, you know she's given these updates multiple times, and you've probably served on other committees with her or seen her around our community. She's been a huge asset. So we're sorry to see her go, but it sounds like it's good things for her family. So she got her master's in public health with a focus in health policy from the George Washington University, and completed her undergraduate degree in history from Whitman College. She has a background in nutrition policy with her work with the Food Research and Action Center in Washington, D.C., and with the Health District, has been working in a wide array of policies that affect the health of our Northern Colorado community. So welcome, Allison, and looking forward to your update.
Great, thank you. So just a reminder, the health districts of Northern Larimer County is a Fort Collins-based special district that has the mission of improving the health of our community through direct care and also through collaboration with our community partners to create broader change. So I sort of have seen this session in like 4 distinct buckets. We have our health insurance and cost of care, and then we have a large bucket of reproductive health and equity, the big bucket of behavioral health, and then sort of COVID recovering and bouncing back from fiscal year 2021. So when it comes to health insurance and cost of care, as Josh mentioned, was the public option. The health district as well is in a neutral position because we commend the idea of addressing cost of care, and we think that's something that needs to occur, but the unintended consequences and the unknowns that could happen with the public option continue to concern us. Also in that bucket is House Bill 21-1297, which is for pharmacy benefit manager and insurer requirements. We had 2 really good provisions in there for consumers, which is real-time responses for patients and providers to figure out questions on costs, benefits, and coverage under an insurance plan for pharmacy benefits, which we think is great. And there was also a provision to sort of prohibit non-medical switching. So basically, it would say if a insurer or PBM changed their prescription formulary mid-year, the person on that plan wouldn't be penalized and no longer have coverage for that drug or have to pay a higher cost for that drug. And we thought that was a great consumer protection, but that unfortunately has been removed from the bill as it has been moving forward. We also are actually in strong support of the Prescription Drug Affordability Board and think it is, with federal inaction, it's one lever that, probably the only lever that the state can take to address pharmacy costs for our constituents. I think one reason why we have such an interest in prescription drug prices is our community health survey has seen that 10% of Larimer County residents have not filled a prescription because of cost. 22% of those that are insured haven't filled a needed prescription because of cost. And almost 20% of people that fly between 186% and 400% of the federal poverty level, so sort of that lower middle income, haven't filled a prescription because of cost. So that really leads to downline unintended, health consequences. In the bucket of reproductive health, Senate Bill 2125 has HCPF seeking a federal authorization to expand Medicaid for family planning services. So women that would have an income that's the same level as the Children's Health Insurance Plan, or in Colorado, the Children's Health Plan Plus, would be able to get coverage for family planning services. This benefit has a federal match of 90%. I think we're leaving money on the table as it is. And 8 other states have taken this option, and we think it is something that Colorado should follow as well. Senate Bill 21-194 is still moving through the system as well. It has a big title of maternal health providers and does a lot of things in between. But I think the big thing for us is that it would seek federal approval for 12 months of postpartum coverage for women on Medicaid and CHP plus. Currently, it's only 60 days, and we know the postpartum period is way longer than 60 days. And we want to make sure that those women stay healthy for the entire first year of their child's life. And then for behavioral health, I think us, the Northern Colorado communities, know that behavioral health is an issue and it needs to be addressed. And I think we need to continue to realize that we are continuing to be an epidemic of substance use disorders and mental health, and the pandemic has only made that substantially worse. I think Children's Hospital Colorado just declared a mental health state of emergency yesterday. And I think that there's stuff being done at the state level, but there could be more. As Josh mentioned, the House Bill 1021, which creates a regulatory framework for peer specialists, is a great start, as long as the creation of the Behavioral Health Administration and a couple other bills aimed at prevention of substance use disorders and behavioral health recovery. But I think there's more that can be done. And one way that that can be done is through stimulus dollars. From the federal level, we know that we'll be getting the almost $3.8 billion from the federal government through the American Rescue Plan Act, and we have yet to see exact details on what that means at the state level and what that means for services like behavioral health. At the health district, we also have a question of what that will mean for social determinants of health as well. We know our unhoused population, you can't stay safe at home when you don't have a home. So addressing that during COVID was difficult and had some health repercussions. And we think that some of that money needs to be looked at for social determinants of health. And then for one big thing for us that happened for the fiscal year 2021 budget was the reduction of the Medicaid adult dental benefit. The maximum was reduced to $1,000, which is not much for people to get done with their needs in their mouth. That has been moved back up to $1,500, and we really applaud the legislature for taking that up and making sure that that continued to be a priority in the budget making process. So that's what I have, and I'm looking forward to having any questions.
Sounds good. Thanks, Allison. All right, last we have Chris Brown. So Chris is the Vice President of Policy and Research with the Common Sense Institute, where he leads the research efforts of CSI to provide insightful, accurate, and actionable information on the implications of public policy issues throughout the state of Colorado. Prior to joining CSI in September of 2017, Chris spent close to a decade working for Regional Economic Models Incorporated. In 2011, he established REMI's Washington, D.C. office and oversaw the growth of the company in the nation's capital and led numerous engagements on both federal and regional policy issues. Highlights of Brown's work cover modeling the fiscal and economic impacts of Medicaid expansion in 8 states and evaluating the economic impact of major air quality regulation in Washington state. He also helped forecast the state-by-state economic effects of budget sequestration with Third Way, a centrist think tank, and examined a small business tax credit proposal for the U.S. Senate. Since joining CSI, Chris has led several reports on a range of policy and economic issues facing the state of Colorado, including measuring the impacts of potential 1% growth caps imposed in the state's major metro areas, analyzing the need and options of the PARA reform, simulating the economic impacts of Colorado schools were number 1, and measuring the economic and fiscal impacts of a 2,500-foot setback for new oil and gas drilling. Welcome, Chris, and excited to hear more about the House Bill 1232.
Okay, fantastic. And just let me know, Jonas, if slides aren't working or audio or there's any issues here. Hopefully.
Perfect. So far, we're looking good.
Good. All right. Yeah, well, thank you again. And I will try to be brief here and do look forward to questions. Imagine there might be some here. And, you know, I've followed one issue in healthcare and my head's spinning. I can't even imagine, you know, Allison and Josh, you guys going through that. It's just, it's a ton of work and it's really impressive. So kudos to you. And I guess, you know, for those of you not familiar with our work, we are a 501c3 nonprofit, nonpartisan research institute. You know, as Jonas mentioned, we get into a lot of different economic and policy issues here in Colorado. And the public option debate really has been really the forefront of our research, along with, you know, several other issues through COVID as well, but for the last over 2 years. And it's, you know, it's, if you hear any frustration in my voice as I talk through this, it's just a reminder that I always have to remind the legislative process is messy. And, you know, we spend 2 years researching this, and then, you know, it all just changes and evolves and is slapped together, in my opinion, in a matter of minutes. So I think it's a challenge to kind of understand exactly where this bill will impact Colorado and Colorado economy. I think there's still quite a few clear areas of concern and unintended consequences that we've highlighted really from the very beginning. But where the discussion around the public option started this year, now think just rewinding back to maybe 2 months ago, the focus has always been, this originated in the state's original plan released in 2019, was this idea of establishing a standardized plan and to be sold in the individual and small group markets. This bill started with a state authority to actually compete directly against private carriers and offer and sell the standardized plan in the event some various measures were triggered. It started with a sort of a requirement of carriers to reduce premiums in the standardized plan of 20% by 2024 relative to plan premium prices across all metal tiers in the 2021 plan year. There was initially no accounting for medical inflation in terms of allowing those prices to naturally grow with cost trends. And medical providers were required to accept the color option plan or face fines or potentially lose your license. And Josh, if there's anything I'm missing here, or as I go through these iterations, let me know and maybe we can flesh this out in questions. But
Chris, real quick, we're in presenter view, so I can see the slides, but it's just a little small. Is there any way to switch the view so we get the full slide?
Let's see here. So why don't I? Yeah, no problem. I think that'll be helpful for the next ones as well.
Okay, thanks.
Did that fix it or no? No. Are we still doing the same thing?
Yeah, same thing.
Let's see here. I'm gonna.
When you have it in presenter view, there's a display settings drop down at the top, and I think it has an option that says swap presenter view and slideshow.
Sorry, where was that again?
Up top there.
So when you have the screen, the slideshow started just like you had, it's at the top. Display settings and then swap.
There we go. Maybe.
There we go. Awesome, thanks.
Yeah, no, sorry about that. I have two screens and usually it works, but I tried the old fashioned, just unplug the other monitor, and I guess that didn't work out.
No worries.
All right. Okay, so this bill, as of 8:47 or something like that, I don't know, last night, evolved quite a bit. As Josh mentioned, there were 5 amendments yesterday. I think that's a total of 20 amendments that have passed. My simple counting of the 75, I think, total amendments. I almost took a screenshot of the sort of amendment schedule so you could see how much has really gone into this debate. Because 50 amendments have failed, I think, on this bill in attempts to change it. So this is my scratched up color option plan latest. And I think the details matter. I mean, since we've been really researching this and discussing this, I think our point and real focus has been the details of this matter. When you look at the details of the plan, when you look at the details of the bill and what it's doing, they really do matter. I think we have some real concerns, and our modeling has really focused pretty much really been trained on the idea, well, if the government has the ability to go in and set prices, whether that's premium rates or to go in and actually set provider rates, you create a host of unintended consequences in the healthcare market as you force reductions in revenue, medical revenue to providers, but you're not really adjusting the underlying costs of delivering that care. And that forces, decisions on the provider side to cut costs in a way that can impact quality and access, or we would see an increase in the cost shifting that already occurs in the market and would impact the remaining commercial market or large employer plans at that point. And so where the bill is, as of now, and I think it'll be debated here again, it passed on a voice vote. So I think it has to pass formally today, and then it'll go to a conference committee. So frankly, at that point, everything could change again, but I have no idea what the remaining elements they're trying to address are. But long story short, we still have a standardized plan. Just as of yesterday, I think they reduced the premium target to 15% of the 2021 plan price. Instead of originally 20, it was 18, and now it's 15. I think a big change that happened was the introduction, and when they did the strike below, they did allow for the accounting of medical inflation in setting these premium prices, which I think, as you'll see in my next slides, really does have a pretty profound impact. And then, here is where, again, some of the details I think for your group really do matter. And then I may not be as fully, understanding of where the latest, again, as of yesterday, and amendments yesterday, will impact medical providers. But, my understanding is that, there's still the ability for the commissioner to require all medical providers, hospitals, and all, physicians and to accept the code option plan. However, I believe the fines were removed for medical providers, and then some of the discussion on the ability to have their licenses suspended or revoked, I think, is only applying to hospitals as well. So, there's, again, outstanding questions. You have to accept it, but there's, I guess, legally no recourse at the moment, but I'm not the lawyer. So, don't take my word for it. And again, this will probably evolve in the next couple of days as well. So what do I, in the interest of understanding the impacts, in the interest of understanding kind of what our concern has been, is we have to understand the sort of starting point for the industry. And I guess I'll slide by this, but our big point has been, if you look to the left of this red line, this has been the individual market up until 2021 plan year. So we had, through 2014, 2016, 18, a huge run up in prices for various reasons. This was the impacted because of implementation of Medicaid and the disruption in the individual markets around utilization and costs, other sets of reforms. Then the state legislature, and really at the push of the governor in many ways, passed a reinsurance bill, which allowed private carriers to reduce premiums and impose a tax on carriers, and I think small and hospitals, drew down some additional federal dollars, and actually has done a ton to reduce. My slides and in some of our reports, we actually show how far premiums in the individual market have come down as a result of the reinsurance bill. So this red line is the trended insurance prices at cost trends. The blue line is actual prices, actual premiums. This off green line ends up being what the requirement under the coder option plan looks like. So with the forecast of medical inflation, that is a 10-year average of a national price index rather than an actual annual adjustment for prices. Long story short, if costs align with this medical inflation index. And that's a big if. Our estimates are that the medical inflation index, as it's currently defined, is only about half of what annual cost trends are projected to be. You would, in fact, so if costs are aligned with what the bill defines as medical inflation, premiums in the individual market would actually be below the price target in the bill because of reinsurance. So that's kind of point one. Small group, which does not have a reinsurance, program, faces a pretty steep climb to achieve this. However, fast forward, and I'd be happy to answer questions on this. I'm way over my time, and we have a report that you can look at these images, and we have sort of a full dissection of this, which again, I don't think is impacted in the latest iterations of the bill. If underlying cost pressures to medical providers through pharmaceutical prices, through utilization costs, through everything actually align with sort of a national trend of about 6%, what we're now faced with is this divergence where the premium pressure against enforced by the code option plan really diverges from where reinsurance would set premiums based upon, again, now costs actually rising faster than what the bill would allow for in terms of medical inflation. And so this gap is really where we will see the unintended consequences and economic impacts as a result of the reduction in medical revenue that we've highlighted throughout our work. Just a quick plug, if you want to go to our website and sign up for our newsletter, listen to our podcast. We've had some great podcasts talking about this issue. So sorry for going over time here, but I think the dynamic of what the bill sets up in the long term as it puts pressure on premiums and how that will trickle through to the entire medical provider community I don't think can be overstated. And there was a great analysis yesterday, I haven't fully dissected it, but released by Milliman, a national actuarial firm, that actually pinpointed a little bit more the regional implications of this because of the regional price disparities. And so I think there's a really strong element to understand, depending on where you are in the state, and Northern Colorado would be very different than other parts of the state because of the pricing dynamics. But again, this is going to have a substantial impact on markets and providers for years to come. So thank you, and happy to take questions.
Okay. Thank you so much to all three of you. We do have one question in the chat. If anybody else has something that piqued your interest or you want to hear a little more on, please type it in the chat and we'll make sure to push it out here. So we have some time allotted for this. Want to make sure everybody gets a chance to get things clarified. First question I have is for Allison, and it says, what does a mental health emergency entail from a facility standpoint and for staff and patients?
So the mental health emergency was declared by Children's Hospital, Colorado. So it was by the facility. I think Josh probably has more information on that. But I think from our perspective, it's going to put pressure on the legislature to act with the federal stimulus dollars to actually pinpoint where that money should be going. There is House Bill 21-1258, which will provide some mental health screening and 3 sessions to youth that screen as needing behavioral health intervention. But we think that doesn't go far enough. And we think that there is a pressure on facilities. And we also think that patients, those youth patients, won't get much out of those 3 sessions and just get some skill building, not true therapy. So we're really looking forward to having a dedicated funding to address not just youth mental health, but mental health and behavioral health across the board in Colorado.
Do you have anything to add, Josh?
I do, thanks.
Great.
So I pulled up some notes that Children's Hospital sent over the other night. So far this year, half of the kids coming into their emergency department at Children's Hospital Colorado, half have been experiencing a mental health crisis. And there are a variety of reasons for that. But I think they are using May is Mental Health Awareness Month. they're using that to highlight just, I think, what is a growing crisis in our state. Colorado ranks number 42 for addressing pediatric mental health, according to Mental Health America, which is not great. Generally, on most healthcare rankings, Colorado is in the top 10, but that one we rank near the bottom. And so I think Allison's right. There are some things moving through the legislature that we are excited about that will help, but we have a lot of work to do for our kids, especially coming out of a pandemic where they've been out of school, experiencing, I mean, listen, I'm a 40-year-old adult, and the pandemic was really hard on me, but I can't imagine going through this as a child. So.
All right, thanks. Couple other questions, and again, make sure you put them in the chat if you guys have anything else. For those of us that lived through the Amendment 69 proposition and eventually the voters turned that down, how does 1232 differ from that? Are there some big differences? Obviously, 1232 is evolving, and I know it's not a final product, but what are the big differences from your perspectives? And I'll kind of open that up to everybody.
I'm happy to kick that one off, Chris.
Thanks.
And Allison. So Amendment 69 was a ballot measure that would have created a single payer model in the state of Colorado, and done away with all private insurance. So as Chris outlined in his slides, and if you get a chance, definitely go to his website. There's so much information there. But we are reliant on, in House Bill 1232, upon the private insurance market. The introduced version was a little bit different, but as it stands today, we are really talking about a new private insurance market product. And so I think that is a positive move in my estimation. But I think the one common factor, and I think this applies to Senate Bill 175, the Prescription Drug Affordability Board as well. Some of the policies we're considering in the state of Colorado look to create effectively an island out of Colorado. Healthcare is a national marketplace. And so if you take actions as a state that put you at a competitive disadvantage with the other 49 states, you stand to potentially negatively impact. As I just mentioned, Colorado ranks near the top on nearly every measure nationally. And so we have the potential to maybe negatively impact us in the national marketplace. And Amendment 69 would have maybe done that on one extreme, but I think that's our consistent caution from the Hospital Association.
Anything to add, Chris or Allison?
I guess, yeah, no, I think there's some pretty interesting distinctions. The big one is, again, Amendment 69 would have had the state become a larger payer and actually required state dollars to go in and cover our healthcare. And here is, it's really imposing price regulations, price caps and on reimbursement rates, on premium rates, that is attempting to restrict the growth in the price of insurance. I guess one interesting just note to make in the market that this is targeting, small group and individual, I guess in particular, individual market specifically, the federal government is a huge payer in these markets through the Affordable Care Act and the subsidies that existed, again, under, the Affordable Care Act. But recently, in the last 2 months, maybe 3 months ago now, I don't know, from the American Rescue Plan, the federal government has expanded the subsidies in the individual market to where they've expanded beyond 400% of federal poverty level and capped premiums for basically anybody at 8.5% of income. And so I don't have a number for you on how much of the total premium in the individual market is being paid for by the federal government, but we are seeing this incremental increase in the federal government becoming the payer in the individual market. So that's a little bit of a side note, but this differs quite a bit from the state actually coming in and funding and paying for health insurance.
Thank you. Yeah, super helpful. The final thing I'll just ask, and I think you touched on this a little bit, but I just want to maybe have you revisit it. So, I mean, what measures, we saw the gap on your slide where we're going to see costs rise much faster than they'll be able to raise premiums. Where do you expect that money to come from? Does that come from the system, right? I mean, that's providers, that's cuts to hospitals. They're going to, potentially have to lower reimbursements, not just, stop inflation. So we have obviously a lot of healthcare providers on this call, both, on the physician side, on the hospital side, all over the place, people that work adjacent to healthcare. I mean, that would have a pretty major impact, right? I mean, that gap is going to come from the people on this call. Is that kind of what you would expect, or?
Yeah, sorry, I don't know who everyone who's on this call, but you're right though. I mean, frankly, health insurance is heavily regulated by the federal government and has federal requirements on medical loss ratios, and their margin, I don't know, is 2 to 4% maybe after you account for all overhead administrative costs. I mean, it's relatively small, and maybe someone on the call is yelling at me that it's different for them, but it's not 15%. Okay, I have full confidence in kind of putting that out there. And so, how do you achieve a reduction of that magnitude? When you consider everything else that's going up in price. I mean, homes are going up, milk is going up. It's staggering to me to consider any business being asked to lower the price of their product by 15% over the next 4 years, when we're not dealing with, say, technology in a TV or a computer that's evolving so rapidly that we can just kind of keep the same product and the price is dropping. It's just not happening in this market. So to your point, yes. And so insurance carriers and providers are going to have to somehow come up with the ability to achieve these targets through the reimbursement rates, or if the premiums are not met or there's not an adequate network, and the network at least as large as carriers currently have, then the state authority, the insurance commission can come in and set those reimbursement rates. And the base rates, I'll just kind of throw this out there, but the base rates for the starting base rate would be 155% of Medicare. And that can extend depending on the type of facility. Pediatric hospitals, I think up to 210%. Starting base rate, but that 155% base rate would be lower, 31 percentage points lower than any statewide average for what hospitals get paid from private insurance in the country. So the base rate, so the dynamic that it's later than 7:30, but it's not quite 8:30, so it's still early. But the dynamic I'm trying to really articulate is you have this pressure on the premium growth that over time, actual costs are going to drive the need to have deeper and deeper cuts to meet those premium targets. And you'll see the state having to go in and set lower and lower and lower reimbursement rates to achieve those premium targets. And their, basement rates. And that, and if you have to accept the insurance, I think that has implications for Medicaid networks, for Medicare networks. I think that has implications for service lines. you know, if we have providers here on the call, you know, your business, it's really a question of how would you react if a certain percentage of your customers that you have to accept pay those 155% of Medicare compared to what you're getting now. Some providers, some facilities may work for their business. Others, it seems pretty clear that won't. So I think this is the challenge of policy and, you know, these setting rates and setting these figures in law and trying to then have this network juggle and adapt over 64 counties, you know, more than 5 million, you know, payers. It's going to be, I think, a real challenge. But you know, I don't know where this goes from here. But I do expect, you know, the bill to pass. But it'll be interesting to see what the final form looks like.
Can I play really quick? We are neutral, but I want to play some devil's advocate.
Yeah, please.
Forward. I think one thing for proponents is the idea of the individual market. I think in Colorado is about 8% of total insurance enrollees. And then it's going to be a plan that's offered alongside every other plan. So how many people are actually going to move to the plan, and providers are going to have to receive those rates? I think that's a big question of how big of a market share is this really going to be? And so how much will it actually affect providers and hospitals' bottom line? I think that's one of the reasons why you are neutrals, because it is such a big question mark. And then I think another I don't know if I necessarily believe this, but devil's advocate from the proponent side would be that, yes, the hospitals and providers may be getting a lower reimbursement rate, but especially for hospitals, there's the idea that the CEOs are making tons of money, and that why would you change your providers' compensation or janitors or X, Y, and Z when you could be looking at your top administrative officials? So there's my devil's advocate for the day.
Yeah.
Those are good questions. We've had lots of conversations about those in the legislature. I think for the market share piece, I think two pieces. The first is, you know, there's a balancing act that occurs between our public and private payers in Colorado. So Medicare and Medicaid represent about half of our market in Colorado. Both of those pay under costs. Medicare pays about 77 cents on the dollar. Medicaid pays about 75 cents on the dollar. And so that has to, that gap has to be shifted to private payers, which is actually why we've seen private insurance rates increasing, because governments, both at the state and federal level, continue to use our public payers as cost-cutting measures. So that's one piece. But when you combine, if you add another, so we're looking at individual and small group, which represents about 15–16% in the state. But if you add that on top of the 50% of our market that it already underpays, you're looking at a pretty significant portion of our market, and how you then balance that back out. So I think, Jonas, to your question of how do you make that up, it gets shifted, and it likely gets shifted to those portions of the market that continue to pay at above cost. That's one piece. On the piece around impact to margins and whatnot, we have about 44 hospitals, if I remember the number right, in Colorado that operate in the red. They operate at a loss every single year, and that's a hugely problematic thing that we defend kind of till the end. And I think those are the ones that we're really worried about, right? That's who we're looking at. We do have some incredibly successful hospitals, but our costs, for our most recent data, hospital operating margins in the state have been at about 5.5% for a 5-year period. Our costs went up at 5.5% over that time. The same way home values went up, the same way the cost of everything, as Chris mentioned, has gone up. And so those numbers get distorted as everything does in politics. But I think we're looking at a delicate balance in Colorado. And so I think that's why we continue to have some pretty significant concerns about the approach taken with the legislation.
Okay,
Awesome. Yep, this will be the final thought. Yeah.
If you allow it. Yeah. One point that I think is really, it may not be, this may be more the sky is falling, but I do think there's a real concern here where if you have a plan in the individual market or small group market that is priced as low as it's required to go, that market will expand because people that currently maybe that might be small employers that are self-insured might say, look, I can save 15, 20% for my employees. So you would actually see that market, I think, grow over time. And actually, when you include small group, it's closer to 15%. So, that's more than 1 in 10 patients potentially at the moment on these plans. And I think, and as you expand again, there's no reason that those that currently self-insure that don't want to take on that risk could say, look, this is a better option because the premium and it has standardized benefits. And we know, what I mean? There's a lot of benefits to the standardization of the plan. That's kind of an interesting piece in itself, but it's these price targets that I think will have these large implications. And then what you end up seeing is, an expanded color option payer and a narrower commercial payer where that cost shifting is even harder to maybe achieve, and it just will force even larger disruption. So it's an interesting dynamic, and we'll see what happens over the next 5-10 years.
Yeah, and it sounds like it's going to pass. So we will definitely be finding out, and all of us will be, on the front lines of figuring out how to adjust to this and how to make it work. And so look forward to future discussions about what we do with this. Anytime there's major legislation, I had somebody earlier in my career that said that's the best possible time to be in the industry. Healthcare, it seems like, has seen a lot of that in the last 10 years, and we've had innovation out of that. So hopefully this will bring some good as well as some real challenges for us. So thank you so much to the three of you. Again, very busy month and time of year, and I appreciate you guys taking some time this morning to share with us. Again, this was recorded, so I know we went through a number of bills at the beginning that are probably distant history at this point, but you can always go back and revisit that. And a lot of these have yet to be finalized. So kind of pay attention. And then once we're done with legislative session, it's always good to get online and go through and look at what actually passed. So again, thank you so much. We'll kind of move on with our program and get to the next speaker.
Thank you, Jonas, and thank you, Joshua, Allison, and Chris for your insights this morning. I invite our members to stay connected with this conversation. We will provide follow-up information once the session is over. We're going to shift gears this morning to our partner, Sandra Jackham. She's going to share with us a regional work-based learning resource called Noco Inspire. Sandra.
Thank you. Good morning, everyone, and thank you for having me today. I am going to do a quick screen share, and hopefully I can share without a hitch. All right, so what I wanted to come on this morning and share with everyone is a collaboration that is happening across Larimer and Weld County with public partners. And this collaboration, our mission is to work really hard and align our education and workforce partners so that we can create more sustainable access, remove barriers, share resources. And our why is to connect businesses to address talent needs. And so our collaboration spans education partners, it spans workforce, and it also includes nonprofits in our communities. We are collaborating with the Talent 2.0 initiative. And some of the points for those of you who are familiar with this initiative that our alliance and our collaboration is working on is connecting employers to talent, building awareness of the local opportunities in our community, the local employers in our community. We're wanting to align better between education and workforce partners. And then, of course, we want to get you all more engaged in the development of your talent pool and your talent pipeline. And so what we've been doing as the Larimer and Weld County Work-Based Learning Alliances is that we have been meeting together regularly to share best practices, to learn more from each other and learn more about each other. We're trying to create an environment where we can better connect businesses to our other partners. So, you know, we understand that your time is valuable. We understand that your needs are vast in with regards to workforce. And so we're trying to create a space where no matter what partner you're talking to, if something else comes up, we can connect you to one of the other partners that can support you in that need. We're also working to create a shared business language across both counties. And then, of course, we're trying to create tools to make that connection and that access easier for our business community. We are, in all things that we do, we work really hard to align with our state Department of Labor and Department of Education. And so one resource that was put out years ago was the Work-Based Learning Continuum. And so we've taken that continuum. We understand that this is built for public partners, and it's kind of speaks our language. But we've kind of taken this model and turned it a little bit to make it more easily understood for businesses, to really help them understand the purpose of each of these work-based learning activity tiers. So you can see that the continuum is learning about work, learning through work, and learning at work. And really what these three tiers represent is an opportunity for industry to build awareness and exposure, an opportunity for businesses to find strategy on how they're hiring and onboarding. And then, of course, learning at work is really about developing and retaining your workforce that you have. So what have we been doing with the support of our Fort Collins Chamber of Commerce and support of Weld County partners? We've been able to host multiple employer roundtables to talk about work-based learning successes and challenges across the region. And with that, I would like to introduce one of the tools that we've been working on over this last year, and that is Noco Inspire. And I'm going to click on this, and hopefully I don't have to do a let me see if I can swap this out. So are we seeing Noco Inspire? Do I need to do a switch?
I think a switch.
I will do that. So Noco Inspire is a website that Larimer and Weld County Work-Based Learning Alliances created. Are we seeing it?
Yep, looks great.
Awesome. So this is a website that we've been working on for the past year, and this is a business user website. So this was created for all of you businesses, organizations in your search for talent. This is a one access point to come in and learn about all the partners across Larimer and Weld County, to learn about the talent that they have, to learn about the types of activities that you as a business can connect in with to help feed those workforce challenges that you have. So really, when you're looking at this website, you'll see a lot of really great information. You're going to be able to learn about the different activities that are supported across our regions. You're going to be able to decide what works best for you and your organization to help solve some of your challenges. And then you're going to be able to directly connect through this website to those partners. And so you can see here we have the three tiers built out so that if you know right off the bat you want to get your brand name out there, you want to talk about an occupation that's high need, you can go into that tier of work-based learning activities, and then you can see all the different activities that are available across Larimer and Weld County. And then you could click on that activity and you can connect to those partners and learn which partners are engaged in that activity. You can also, if you know there's a partner you want to connect with directly, you can go to our Alliance partner page and you can see a list of the Larimer and Weld County partners. And from there, you can click on a partner, and then you can read about what they are doing. You can connect directly with them. You can see success stories of the activities that they've been doing. We also have, through this resource as a tool, we have an FAQ page, because I know oftentimes businesses have general questions about differences between internship and apprenticeship. You know, how to work with youth, how to work with folks who may have disabilities. You know, so we've kind of collected those general FAQs to put them in here to get those answers to businesses quickly. We also have a resource page where businesses can, and this is continuing to build out, but where you can, you know, look at the definitions to understand that, learn more about apprenticeships, about work-based learning across the state. We have some information about economic development programs and things like that. So this is just really an opportunity for you as a business to have that one place to go to begin that work. And if you're the person who says, I don't want to have to read through this website, I want to just talk to somebody and have them talk with me about what these options are, that for you, just go straight to that contact page. And through that contact page, you can come in, say, this is who I am. Maybe these are the people I want to connect with, or here's some of the activities I'm interested in, and you can hit send. And what will end up happening is you will get contacted by either a Larimer County Work-Based Learning Navigator or a Weld County Work-Based Learning Navigator, and we can sit down with you and we can talk about what your workforce challenges are, where your gaps are, and then we can talk about the different options for work-based learning and how to connect, and why it will matter and why it will make a difference. And then we can make the connections for you, so you don't have to try to navigate sometimes these very big systems and trying to find the right person. We are really excited about Noco Inspire. We're happy to hopefully provide an opportunity for you as industry folks to find those connections and to build out and be involved in the building out of your talent pipeline. One other little cool fact about Noco Inspire and this website and the great collaboration of all of these public partners is that in this website, we worked really hard to have it reflect who we are as a community. And so if you go to this website and you peruse it, every picture is a local picture. So that you may find that, you know, your industry, your company may be represented on this website through these photos. But we were really proud to be able to showcase all the work that has already been done here locally and showcase those folks and showcase those industries. So I do want to give an opportunity to open this up for any questions if anybody has. I'm going to take a quick look. So if you don't have questions, but maybe you want to learn a little bit more about Noco Inspire, I would encourage you to go in, reach out through the contact page. We can have somebody sit down and chat with you. There are a lot of work-based learning opportunities available through all of the public partners, starting with our K-12 up to our 4-year and including our workforce partners. And so one thing that I would encourage you is that there is something for every person in every industry. So I would encourage you to find those opportunities to connect as light touch as you can have the time for, or as involved as you want to get. We have the full spectrum of opportunities, and we're really, as public partners and our collaboration, we are just here to support you, to support the work that you all are doing and finding that workforce and building that workforce. So we're here, we're happy to help, and any suggestions that you all have on making this easier and more accessible, we are always welcome to making those changes and shifting our practices. Thank you everyone for your time this morning, and I'm excited to be here and supporting you all.
Thank you, Sandra. Thank you, Amber, for popping that link into the chat for us this morning. Great tool, and we love to see the collaboration that went into this great resource. Thank you, thank you, thank you. We're going to shift gears yet again this morning to give you all some updates on what our committees have been hard at work achieving. We're going to start with our Workforce Committee. Evan, take it away.
Thank you, Joanne. And thank you, Sandra, and that team. That was great stuff. Thanks for sharing that. So good morning, everyone. My name's Evan Hyatt, and I'm one of the co-chairs of the Workforce Committee for the Noco Health Sector Partnership. And first thing I guess I should share as an update is we've had a few changes with the Workforce Committee. Melissa Henry, who had been a co-chair with me, has stepped down in that role. Melissa is going to remain a member of the committee and continue to contribute that way, and she's been a big help. And Chris Houston from Front Range Community College is going to step in and be a co-chair now. What we found is it's worked very well from the beginning when Lynn Bossler and Bill Stout started this co-chair arrangement to have a person from healthcare industry partnered with someone who's in the public sector, either education or workforce development. And so Chris is going to step into that role. So thank you, Melissa, for all your help. And we're looking forward to you continuing on the committee, and welcome Chris as the co-chair. And so what has the Workforce Committee been doing? We meet the second Tuesday of each month from 2:30 to 4. And these are the primary areas that we're working on. As Sandra was just talking about, work-based learning and career exploration is a big part of what we talk about. And then also the Get Into the Guts program, which is headed up by Lynn Bossler, is an actual, well, it's a way to introduce middle school and high school students to healthcare roles. And at a time when we could, we were actually taking students out to visit employers in the area, and then they got very creative and did some work in filming, doing virtual visits, which are posted on our website if you'd like to see any of those. And we're hoping by this fall that we'll be able to get back and do those in person. We also have a group that helps us with any kind of data gathering that we need to. They're not always working, but when we need things, they activate or and provide some great data for us. And then we also have a group that helps communicate what all of these groups are doing, and Jonas is a big help on that. Again, if you visit the website, you'll see all the activities that are going on, and we've got a slide on one of our next ones that are coming up. One of the things we entered into recently that we allow ourselves to do is to have some special projects from time to time. And so we are going to do a deeper dive into things to really find out some information to hopefully help address as best we can. We know there are a lot of groups working on this, so we're going to see how we can help with addressing the needs for RNs in the Northern Colorado area. We did this some time ago with medical assistant roles, and that seemed to help very well. So we're going to try and do something similar with RN roles. If you'd want to join any of these committees or join the overall Workforce Committee, you can contact myself or Chris. Our contact information is again on the Noco website. So feel free to email either one of us or email Nikki, and we can get you on the mailing list to attend these meetings and participate. As I mentioned, one of the things I think we want to make folks aware of, Nikki, do you want to go to that next slide, is the next virtual panel that we have. Our work-based learning group organizes these panels. They're virtual chats, and this is the next one coming up on June 8th. And from 9:30 to 10:30. And so, again, there's information on the Noco Health Sector website about how to register for this and be part of this to listen in. And these are the, they'll have industry experts talking about all of these positions. All right, and I think that, oh, and then this is what the Getting Into the Guts group is doing. I think I had mentioned we were doing some virtual tours, Lynn and her group, and the most recent one was with Eye Center of Northern Colorado. This is, again, posted on our website if you'd like to go view that. And they have goals of doing their next one with Fort Collins Family Medicine, be completed later next month, and then posted as well. And then next, Nikki. Oh, next I introduce Anna Vondriel, who is the chair of the Behavioral Health Committee. And Anna's going to share updates from that committee. Thank you.
Great, thank you, Evan. Yeah, those are great efforts that you guys are doing, and some of it we are kind of collaborating a bit with the Workforce Committee, which I'll get to in a moment. So for the Behavioral Health Committee, our focus the last couple of years has been really on trying to inspire that next generation of behavioral health professionals. As we were talking about with the different bills coming through the state legislature, and what we've all been experiencing this last year, is the really critical need for behavioral health services and to have those professionals to be able to help support all the different efforts that are going on in our communities. So the last 2 years, we've been focused on that and trying to get that next generation. We have 2 different efforts. The first one being, started back in 2020, actually. We had our first exploratory event. It was held at UNC and very successful. We targeted college students, undergraduate and graduate students, and we not only had UNC students there, but we also invited CSU, Ames, and Front Range Community College students to attend, and it was a great event. We had panels, we had speakers of local professionals in our community to be able to help understand what it means to be in behavioral health, all the different options, the pathways to take to get to what that ultimate goal is. And so we replicated that this past February at CSU. Unfortunately, with the pandemic, we did it virtually, but again, it was very successful. We had great attendance. And this time, because it was virtual, we actually invited high school students as well. And so again, trying to catch students before they get into college to see how we might be able to inspire them. So we did that, and now our next event that we're starting to plan will be next February at UNC campus. Our hope is that we can kind of alternate between campuses, and this time hopefully we can be in person. The one thing that we noticed between the 2 different, the first and the second events, was having that networking ability in person was something that the students missed with it being virtual. So now that we're going to plan being in person, we're really hoping that we can create those connections with professionals and students. So next slide, Nikki. And then our other effort that we've been focused on is developing a resource library of videos. We started with videos of just different local behavioral health professionals, just answering those questions of why they love doing what they do, and hoping to make those available on our YouTube channel, so that we can, and students or anyone can view those videos. And the next effort that we're going to do is start to do a day in the life. So doing a longer video with different professionals and videoing them at their workplace, and kind of giving that what is it really like experience. So that's what we've been working on, and Joanne and Crystal are heading up those efforts. So if you are interested, I would really encourage you to go onto our YouTube channel. It not only has what our efforts have been doing, because our second annual event that we did back in February, we videoed and is on our YouTube channel. But also I believe that the Workforce Committee, their video efforts are listed there as well. So check it out. It's a great resource. And also a side note is that we're working also with the Workforce Committee on that nursing shortage effort that we're going to be starting. So I invite you to join us. We would love to have people work with us. We meet the second Wednesday of every month in the morning, and reach out to me, or it's on our website as well. But happy to have you join us. Thank you.
Thanks, Anna. I love that we have a YouTube channel and we have that resource available to our communities. That's awesome. Next, we're going to hear from Yvonne Myers. She's going to talk about PASSAR.
Good morning. Thanks for having me visit a little bit today about PASSAR. You know, we've had such a great meeting today and so much happening in the healthcare space. And so PASSAR seems like a little component, but it really is a big darn deal. It's a pre-admission screening and resident review that takes place when people, seniors, older adults, come from the community into a nursing home. So whether they're coming from the hospital, from an assisted living, from their homes, a pre-admission screen is required. And in Colorado, they really have been over the last many years trying to find out the right agency to use, the right platform, the right way to make this smooth and simple, and to screen folks for their mental health status to be sure they're getting the mental health resources and services that they need. And so we were working with EQ Health for the last year and a half, and over the February and March timeframe of this year, switched to a new company out of Montana, which is a really, really good company who's been doing it in Montana for 4 years. So we're excited for the new platform. Of course, there's always a change when you switch to new platforms and new systems. The 1135 waivers that we're all a part of, all of us in healthcare, all are very aware of our 1135 waivers, waived the requirement for the pre-admission screen to take place when somebody comes from a hospital into the community, into a nursing home under their Medicare stay, which also then affects 1135 waiver is very significant in helping people come directly from home, directly from the emergency room, without having to go through this screen that sometimes can take days and hold up their admission. And I think the whole reason for waiving it was during COVID to move people quickly out of hospitals to make room for hospital beds for COVID patients and move healthier folks out that are not COVID into the next level of care. And suddenly in Colorado in March, we get notified that as of April 22nd, which is when the public health emergency, it's can only be ratified in 90-day increments. So it was going to end on April 21st until Health and Human Services Director Becerra rewrote it to go till July. But Colorado said, well, we're going to reinstitute PASSAR effective midnight of April 22nd. And it was a very quick turnaround, and people remembering how it works and what goes on, because it's been waived for an entire year at that point. So it started on Thursday the 22nd at midnight, and by 3:30 the 23rd, so 30 some hours later, it was rescinded, and it went back to what happened last March, which is it is waived at this point. So that we don't know why that seemed crazy. I think it was crazy for Hickcliffe as well. And so I don't know whether people were so lost and it was so crazy, but it only took them a day to figure out that that's not really working. So at this point, the state will not answer the question of whether they will not start it again until the 1135 waivers are amended, or whether they'll start it again prior, because states don't have to follow the waivers, they tell us. So we have a chance to give input to them about whether they should start it up again, the pre-admission part coming from hospitals. And so our committee is working with our hospital partners to say what the impact is to them, how the 1135 waivers have made patient movement easier and better, and then from the nursing home side, you know, what we find helpful and not. So if you have anything to do with PASSAR, if you have any ideas or comments, or want to provide written input with us, in our committee, please email me. I'm on the website as well as a committee chairperson. Here it is right there on the screen. Please let me know. We hope to gather information and maybe send it out the week of June 7th. So you got a couple weeks to send me some information, or just give me a quick call and I'll write your thoughts down and we'll get that to the state as well. So PASSAR is such a little itty bitty thing, but I will tell you it is a big impact to people moving between levels of care. So thank you.
Thanks, Yvonne, and thanks to all our committee chairs for your leadership and the quality work we do here. We are so grateful for the support of our sponsors, City of Fort Collins Chamber of Commerce, Columbine Health Systems, UC Health, City of Greeley, Front Range Community College, and the Colorado Workforce Development Council. We are proud to share that we are a recent recipient of the Colorado Workforce Development Council's grant focused on sector stabilization and recovery. Their commitment to our partnerships initiatives allow us to continue to make significant impacts in our region, and we are incredibly grateful for all of the partners listed here. If you are in a position to also support our efforts with a financial contribution, we'd love to talk about how your passion could align with ours. You can reach Yvonne and I through the nocohealthsector@gmail.com email address. And in closing, I'll invite you all, please join us for our next quarterly meeting in August. We are hopefully going to be meeting in person, so stay tuned for more information on the location of that August 25th, quarterly meeting. I thank you all for your participation in this great dialogue this morning and wish you all a fabulous Wednesday.